Why does conductive hearing loss make sounds feel muffled? Imagine trying to listen to your favorite song, but everything sounds like it's coming through a thick blanket. That's often what people with conductive hearing loss experience. It happens because something blocks or disrupts the way sound travels through the outer or middle ear. Instead of reaching the inner ear clearly, the sound gets muffled or distorted. Normally, sound waves enter the outer ear canal and hit the eardrum, causing it to vibrate. These vibrations then pass through three tiny bones in the middle ear called the malleus, incus, and stapes. These bones amplify the vibrations and send them to the cochlea in the inner ear. The cochlea then converts these vibrations into electrical signals that the brain interprets as sound. In conductive hearing loss, this process is interrupted. Common causes include earwax buildup, which physically blocks the ear canal, or fluid from infections that dampen sound transmission. Damage or perforation of the eardrum can also interfere with sound vibrations. Problems with the middle ear bones, like stiffening or damage, can prevent vibrations from passing effectively. Because of these issues, less sound energy reaches the cochlea. This reduction in sound transmission makes sounds seem quieter and less clear. Speech sounds, especially consonants which are higher in pitch, become harder to distinguish. That's why conversations can be challenging, especially in noisy places. It's important to note that once the sound reaches the inner ear, the clarity remains intact. The problem is that less sound gets there in the first place. Most causes of conductive hearing loss are treatable. For example, removing earwax or treating infections can restore normal hearing. Damage to the eardrum or middle ear bones may require medical procedures, but many of these issues are reversible or manageable. This is different from sensorineural hearing loss, which involves damage to the inner ear or auditory nerve and is often permanent. In summary, conductive hearing loss makes sounds feel muffled because it blocks or weakens the transmission of sound waves from the outer or middle ear to the inner ear. This results in a reduced and less clear sound signal reaching the brain, making everything sound distant or blurry. If you experience hearing difficulties, it's always best to consult a healthcare professional for proper diagnosis and treatment options.